My name is Tanya McCauley, and I am the nurse practitioner for Team Wellness Center, Eastern Market. Today, I am going to be talking to you about the diagnosis bipolar disorder. Bipolar disorder is a brain disorder that affects the mind due to decreased levels of dopamine and serotonin. You might know this diagnosis as manic depressive or manic depression disorder. Bipolar disorder, the variations in the levels of the dopamine and the serotonin affect functionality, excitability, memory, and sleep. When we look at dopamine directly affects the reward center in the brain and the pleasure center in the brain. Dopamine also controls movement and emotion. When we talk about the serotonin levels primarily affect sleep, mood, sexual activity, functionality, learning, and memory. This disorder affects more than 2.3 million Americans annually. And of the 2.3 million Americans affected by bipolar disorder, 7 out of 10 will actually receive an inaccurate diagnosis when being seen by their healthcare provider. That leaves only 3 individuals out of 10 who will actually receive an accurate diagnosis and accurate treatment at the initial evaluation. It is important to get an accurate diagnosis for bipolar disorder because more than 30% of individuals who go untreated actually commit suicide. This is a very staggering number. So what I would like to talk to you about today is some of the early recognition signs and symptoms that you might present to your healthcare provider and request a referral to be evaluated by a mental health professional. Bipolar disorder, bi meaning two, because bipolar disorder includes 2 dysfunctions. One is considered a manic phase and the other is considered a depressive phase. In the manic phase, individuals will be overly excited. They will have an increased amount of energy. They will be highly talkative. They will seem overproductive. They also will require very minimal sleep, but yet will be severely energized. They may be very irritable and have mood shifts that change very frequently during their manic phases. When we look at the depressive phase, we see the extreme opposite of the manic. In the depressive phase, we see individuals that are depressed. They may be sad, they may be crying, they may consider themselves worthless and hopeless. They may have a poor outlook on life, and most of these individuals also have a problem with thinking of hurting themselves or harming themselves, and they may actually go out with a plan. And that is why it is so very important to get an accurate diagnosis with bipolar, especially when we're dealing with the depressive form of the bipolar disorder. If you yourself feel that you have any of these symptoms, or if you know of someone that has any of the symptoms that I've mentioned, it is extremely important to report this to your primary care provider and to your mental health professional so that you can be properly evaluated. You know, bipolar is not curable, however, it is treatable. With the appropriate amount of staff intervention, early recognition, implementation of medications, use of cognitive behavioral therapy, individual therapy, family therapy, and group sessions, it is very easy to get this diagnosis to a point where it does not alter the functions of your life. Some very important things that I want you to know about bipolar is that when people are in the manic phase, they often feel quite on top of the world. Like, they can just do about anything. They have all this creativity and energy. And I want you to know that you're not alone. There are many people, as I mentioned, diagnosed with bipolar disorder annually. And you might be surprised to find out that there are some quite famous people that you may know that have bipolar disorder. So I'm going to just jot down at my list real quick because I didn't want to forget any of the names, but I want you to know that these are some individuals just like yourselves that are diagnosed with bipolar. We have Edgar Allan Poe, who was a writer, and he was a very famous writer. Also, we have Florence Nightingale. As you may know, Florence Nightingale was in medicine, and she was the nurse who went out to the troops when they were injured and hurt, and came up with some very ingenious medical treatment plans that actually helped to heal the soldiers and get them back on the battlefield and saved quite a few lives. We have Vincent van Gogh, who was one of the most famous artists. We have Catherine Zeta-Jones, who's known for her film work and also for her Broadway work. We have Robert Downey Jr. He's also known for Broadway and film, but what you might know about Robert Downey Jr. is that he had a very public manic episode that was seen and shown in the newspapers and on TV, and it showed the extremes of how manic people can act to the point of hurting themselves, hurting others, and having bizarre behavior, which was documented on him. We also have Mel Gibson, who also had an incident that was documented. He's an actor and he's in film, very creative. We have Jesse Jackson, who's a politician, and the famous singer, Nina Simone, who was also diagnosed with bipolar disorder. These are some very ingenious, creative individuals just like you. And with the proper assessment and management, you can function with bipolar disorder. You can be productive with bipolar disorder. You can live a happy and fulfilled life with bipolar disorder. So I would ask that you would seek out help and assistance from our team staff. Of course, you can come in as an intake, or you can contact us at our 313-396-5300 number, and we would direct you to the appropriate staff to assist you. I would like to say thank you today for allowing me to do this presentation on bipolar disorder. Have a great day.